300-item NLE practice exam. Situation A. Richard has a nursing diagnosis of ineffective airway clearance related to excessive secretions and is at risk for infection because of retained secretions. Part of Nurse Mario Euro's nursing care plan is to loosen and remove excessive secretions in the airway. 1. Mario listens to Richard Euro's bilateral sounds and finds that congestion is in the upper lobes of the lungs. The appropriate position to drain the anterior and posterior apical segments of the lungs. When Mario does percussion would be A. Client lying on his back, then flat on his abdomen on Trendelenburg position. B. Client seated upright in bed or on a chair, then leaning forward in sitting position, then flat on his back and on his abdomen. C. Client lying flat on his back and then flat on his abdomen. D. Client lying on his right, then left side on Trendelenburg position. 2. When documenting outcome of Richard Euro's treatment, Mario should include the following in his recording except A. Color, amount, and consistency of sputum. B. Character of breath sounds and respiratory rate before and after procedure. C. Amount of fluid intake of client before and after the procedure. D. Significant changes in vital signs. 3. When assessing Richard for chest percussion or chest vibration and postural drainage, Mario would focus on the following except A. Amount of food and fluid taken during the last meal before treatment. B. Respiratory rate, breath sounds, and location of congestion. C. Teaching the client's relatives to perform the procedure. D. Doctor's order regarding position restrictions and client's tolerance for lying flat. For Mario prepares Richard for postural drainage and percussion. Which of the following is a special consideration when doing the procedure? A. Respiratory rate of 16 to 20 per minute. B. Client can tolerate sitting and lying positions. C. Client has no signs of infection. D. Time of last food and fluid intake of the client. 5. That the purpose of chest percussion and vibration is to loosen secretions in the lungs. The difference between the procedures is A. Percussion uses only one hand, while vibration uses both hands. B. Percussion delivers cushioned blows to the chest with cupped palms, while vibration gently shakes secretion loose on the exhalation cycle. C. In both percussion and vibration, the hands are on top of each other and hand action is in tune with Client Euro's breath rhythm. D. Percussion slaps the chest to loosen secretions, while vibration shakes the secretions along with the inhalation of air. Situation A. A 61-year-old man, Mr. Regalado, is admitted to the private ward for observation after complaints of severe chest pain. You are assigned to take care of the client. 6. When doing an initial assessment, the best way for you to identify the client's priority problem is 2. A. Interview the client for chief complaints and other symptoms. B. Talk to the relatives to gather data about history of illness. C. Do auscultation to check for chest congestion. D. Do a physical examination while asking the client relevant questions. 7. Nancy blames God for her situation. She is easily provoked to tears and wants to be left alone, refusing to eat or talk to her family. A religious person before, she now refuses to pray or go to church, stating that God has abandoned her. The nurse understands that Nancy is grieving for herself and is in the stage of 1/4. A. Bargaining. B. Denial. C. Anger. D. Acceptance. 8. Which of the following ethical principles refers to the duty to do good? A. Beneficence. B. Fidelity. C. Veracity. D. Non-maleficence. 9. During which step of the nursing process does the nurse analyze data related to the patient's health status? A. Assessment. B. Implementation. C. Diagnosis. D. Evaluation. 10. The basic difference between nursing diagnoses and collaborative problems is that A. Nurses manage collaborative problems using physician-prescribed interventions. B. Collaborative problems can be managed by independent nursing interventions. C. Nursing diagnoses incorporate physician-prescribed interventions. D. Nursing diagnoses incorporate physiologic complications that nurses monitor to detect change. In status, situation Euro, Mrs. Seva, 52 years old, asks you about possible problems regarding her elimination now that she is in the menopausal stage. 11. Instruction on health promotion regarding urinary elimination is important. Which would you include? A. Hold urine as long as she can before emptying the bladder to strengthen her sphincter muscles. B. If burning sensation is experienced while voiding, drink pineapple juice. C. After urination, wipe from anal area up towards the pubis. D. Tell client to empty the bladder at each voiding. 12. Mrs. Seva also tells the nurse that she is often constipated. Because she is aging, what physical changes predispose her to constipation? A. Inhibition of the parasympathetic reflex. B. Weakness of sphincter muscles of anus. C. Loss of tone of the smooth muscles of the colon. D. Decreased ability to absorb fluids in the lower intestines. 13. The nurse understands that one of these factors contributes to constipation. A. Excessive exercise. B. High fiber diet. C. No regular time for defecation daily. D. Prolonged use of laxatives. 14. That you would do nasopharyngeal suctioning on Mr. Abad. Your guide for the length of insertion of the tubing for an adult would be A. Tip of the nose to the base of the neck. B. The distance from the tip of the nose to the middle of the neck. C. The distance from the tip of the nose to the tip of the earlobe. D. 8 to 10 inches. Situation: Mr. Dizon, 84 years old, brought to the emergency room for complaint of hypertension. Flushed face, severe headache, and nausea. You're doing the initial assessment of vital signs. 15. That you are to measure the clean-EUROS initial blood pressure reading by doing all of the following. Except 2/4. Take the blood pressure reading on both arms for comparison. B. Listen to and identify the phases of choric coffee EUROS sound. C. Pump the cuff to around 50 millimeters of mercury above the point where the pulse is obliterated. D. Observe procedures for infection control. 16. That a pulse oximeter is attached to Mr. Dizoni EUROS finger. 2. A. Determine if the clean EUROS hemoglobin level is low and if he needs blood transfusion. B. Check level of client's tissue perfusion. C. Measure the efficacy of the client's antihypertensive medications. D. Detect oxygen saturation of arterial blood before symptoms of hypoxemia develops. 17. In which type of shock does the patient experiences a mismatch of blood flow to the cells? A. Distributive. C. Hypovolemic. B. Cardiogenic. D. Septic. 18. The preferred route of administration of medication in the most acute care situations is which of the following routes? A. Intravenous. C. Subcutaneous. B. Epidural. D. Intramuscular. 19. After a few hours in the emergency room, Mr. Dizon is admitted to the ward with an order of hourly monitoring of blood pressure. The nurse finds that the cuff is too narrow, and this will cause the blood pressure reading to be A. Inconsistent. B. Low systolic and high diastolic. C. Higher than what the reading should be. D. Lower than what the reading should be. 20. Through the client's health history, you gather that Mr. Dizon smokes and drinks coffee. When taking the blood pressure of a client who recently smoked or drank coffee, how long should the nurse wait before taking the clean EUROS blood pressure for accurate reading? A. 15 minutes. B. 30 minutes. C. 1 hour. D. 5 minutes. 21. While the client has pulse oximeter on his fingertip, you notice that the sunlight is shining on the area where the oximeter is. Your action will be to A. Set and turn on the alarm of the oximeter. B. Do nothing since there is no identified problem. C. Cover the fingertip sensor with a towel or bedsheet. D. Change the location of the sensor every 4 hours. 22. When taking blood pressure reading, the cuff should be A. Deflated fully, then immediately start second reading for same client. B. Deflated quickly after inflating up to 180 millimeters of mercury. C. Large enough to wrap around upper arm of the adult client 1 centimeter above brachial artery. D. Inflated to 30 millimeters of mercury above the estimated systolic BP based on palpation of radial or brachial artery. 2.3. TEO. Ensure client safety before starting blood transfusions. The following are needed before the procedure can be done except A. Take baseline vital signs. B. Blood should be warmed to room temperature for 30 minutes before blood transfusions is administered. C. Have 2 nurses verify client identification, blood type, unit number, and expiration date of blood. D. Get consent signed for blood transfusion. 2.4. MR. Bruno asks what the normal allowable salt intake is. Your best response to Mr. Bruno is A. 1 teaspoon of salt/day with iodine and sprinkle of MSG. B. 5 GMS per day or 1 teaspoon of table salt/day. 3/4. C. 1 tablespoon of salt/day with some patties and toyo. D. 1 teaspoon of salt/day, but no patties and toyo. 25. Which of the following methods is the best method for determining nasogastric tube placement in the stomach? A. X-ray. B. Observation of gastric aspirate. C. Testing of pH of gastric aspirate. D. Placement of external end of tube underwater. 26. Which of the following is the most important risk factor for development of chronic obstructive pulmonary disease? A. Cigarette smoking. B. Occupational exposure. C. Air pollution. D. Genetic abnormalities. 27. When performing endotracheal suctioning, the nurse applies suctioning while withdrawing and gently rotating the catheter 360 degrees for which of the following time periods? A. 10 to 15 seconds. C. 20 to 25 seconds. B. 30 to 35 seconds. D. 0 to 5 seconds. 28. The nurse auscultates the apex beat at which of the following anatomical locations? A. 5th intercostal space, midclavicular line. B. Midsternum. C. 2 inch to the left of the lower end of the sternum. D. 1 inch to the left of the xiphoid process. 29. Which of the following terms describes the amount of blood ejected per heartbeat? A. Stroke volume. B. Cardiac output. C. Ejection fraction. D. Afterload. 30. You are to apply a transdermal patch of nitroglycerin to your client. The following are important. Guidelines to observe except A. Apply to hairless clean area of the skin, not subject to much wrinkling. B. Patches may be applied to distal part of the extremities like forearm. C. Change application and site regularly to prevent irritation of the skin. D. Wear gloves to avoid any medication on your hand. 31. The gauge size in ET tubes determines A. The external circumference of the tube. B. The internal diameter of the tube. C. The length of the tube. D. The tubulo's volumetric capacity. 32. The nurse is correct in performing suctioning when she applies the suction intermittently during A. Insertion of the suction catheter. B. Withdrawing of the suction catheter. C. Both insertion and withdrawing of the suction catheter. D. When the suction catheter tip reaches the bifurcation of the trachea. 33. The purpose of the cuff in tracheostomy tube is to A. Separate the upper and lower airway. B. Separate trachea from the esophagus. C. Separate the larynx from the nasopharynx. D. Secure the placement of the tube powered by TCPDF, www.tcpdf.org. For /4.